How are you doing this morning? Everyone comes to me and says, Dr. Frost, Billy or Bobby or Mary cracks her neck, cracks her back, cracks her knuckles, and I tell her to stop that. I tell them to quit it. Is that good advice, bad advice? What does it mean? And I always tell Billy or Mary, I say, Billy and Mary, don't crack your neck, your back, your knuckles in front of your parents. It bugs them. So, to answer the question, it's this. It is not bad to crack your neck, your knuckles, your back, unless when you do it, it hurts or it locks. Now, 98–99% of my patients over the years, I've asked this question. I said, when you crack your knuckles, when you crack your neck, your back, does it feel better? And they say, yeah, it does. Well, your body is a biofeedback mechanism, right? And it's always giving you information. And sometimes when these joints move just a little bit to the right, a little bit to the left, these are microscopic movements in terms of just millimeters. And your brain may give you a signal that says, if you could just move that a little bit, I'd feel better. And so you do. And guess what? You feel better. It's just like if you've had back pain or sciatica, sometimes you just move to get off that nerve. Why? Because your brain gave you a signal saying, get off the nerve. So back to how this all started about cracking your knuckles in your back. Back in the old days, whenever that was for you, your grandma had severe osteoarthritis or degenerative arthritis, or perhaps she had rheumatoid arthritis with the gnarly knuckles and fingers. And our parents would warn us, if you keep doing this, that's going to happen to you. Well, not so. Studies show that children who are knuckle crackers actually have lower incidences of arthritis as they age than children who don't. We also know anecdotally that children are constantly moving. They're constantly moving their head, their neck, their body. They're stretching their muscles and their joints. And as we age, we become, unfortunately, more and more sedentary. And we stop stretching our muscles. We stop moving our joints. And the ultimate loss of motion is called, correct, rigor mortis. So let's keep these muscles. Here's the story. Keep your muscles, your joints moving. As we age, we lose that ability to crack our knuckles or crack our neck. But in our younger days, the joints are so mobile, so fluid, so lubricated. They can do it. Don't worry about it, only if it becomes a problem that I told you about before. Thanks.